Are you guys following what is going on with these healthcare workers and the strike against Kaiser Permanente? This is huge, and it is culminating with what is going on in America with the medical community being in flux since COVID 19. COVID 19 just brought out all of the dysfunction that was going on in the medical community. The American public seems to be going on strike for various reasons. And it just seems to be the employees are rising up against these big corporations where the top is making all of the money and throwing a few pennies towards the bottom. I'm going to skip to the bottom of the Axios article just to remind everybody. I'm sure y'all know Hollywood actors and writers were on strike. The writers just returned to work after 148 days of work stoppage. The actors are still striking. The United Auto Workers began striking last month. This is big. Ford, GM, and Stellantis over wages, benefits, and workers' protections. So this is huge. And then now we have Kaiser Permanente, which covers lots of employees and will impact so many different people. And it's not just in one particular state, it covers several states. The reason why I'm doing the ending first is just to remind everybody that this country there's a lot brewing underneath because so many people are feeling disgruntled because the cost of living are way too high, and they are in these employers, the C-suite, the CEOs, the CFOs, the money people are making like 300 times more than the employees, and folks are like barely surviving and scrapping by. So we're in flux currently. Now, to get back to Kaiser Permanente workers at hospitals and medical offices around the country began a strike yesterday. Why it matters. The work stoppage covers an estimated 75,000 employees at the nation's biggest nonprofit healthcare system. It is expected to be the largest healthcare strike in U.S. history, according to a coalition of unions leading it. The strike includes workers in California, Oregon, Washington, Colorado, Virginia, and Washington, D.C. Nurses, radiologists, X-ray technicians, ultrasound sonographers, and others are expected to join the picket line. So the union's contract with Kaiser expired on September 30th. Staffing shortages are a major sticking point. They have led to what workers say are unsafe conditions and negatively affected patient care. Carolyn Lucas, executive director of the Coalition of Kaiser Permanente Unions, told CNBC. Hillary Costa said in an email statement Wednesday evening that Kaiser had reached several tentative agreements in bargaining that it believes addresses the union's priorities. These include across-the-board wage increases in all markets over the next 4 years, updating the performance sharing plan to include a minimum payout opportunity and potential for up to $3,750, offering a minimum wage of $23 an hour in Cali and $21 an hour outside of Cali. Continuing and enhancing existing health benefits and retirement income plans, renewing tuition assistance and training programs, and increasing the funding for education trusts. What they're saying, Kaiser and union representatives worked through the night and made progress. So we're going to see. She says, we remain committed to reaching a new agreement that continues to provide our employees with market-leading wages, excellent benefits, generous retirement income plans, and valuable professional development opportunities. The healthcare workers within the coalition remain ready to meet at any time. Currently, the strike continues, and there are no sessions scheduled at this hour. So that is where they are. Now, I know some people will be irritated with the fact that their healthcare providers are in flux. But if they are constantly being overworked, overscheduled, it is not healthy and it's not conducive and it's not safe. They are running these people ragged. I have done videos where I've talked about how so many nurses are quitting, how doctors are leaving certain areas because of political unrest. There are just a lot of factors happening at one time, and the overdoing it with the patient load on nurses is causing people to be tired, to be stressed, to be burnt out. So all of this is culminating at once, and it's going to be really interesting to watch it unfold. You guys go ahead and join the conversation. Let me know what you think. Like, comment, share.